Good afternoon, and my name is Veronica Jones, the Vice Chairwoman for the County Commissioners at Large and the Chair for the Liaison, City and County Liaison meeting. Today is Monday, September 15th. I am pleased to announce that the members of this particular committee that is going to be co-chair Mayor Pro Tem Kathy Jensen, and she will be joining us soon and very soon. We also have serving on this particular committee Chairman of the Cumberland County Board of Commissioners, Kirk Deviere, and we also have Mayor Mitch Coben of the City of Fayetteville, as well as Commissioner Pavan Patel, Cumberland County Board of Commissioners, as well as City Council Member Ms. Courtney Banks McLaughlin. For all of you that are here today, we welcome you. If we have we have joining us some other elected officials that are here today from the city. I see that we have City Council Member Alejandros, and also we have, I'm sorry, you all. Mario Benvente, and we also have
Derek Thompson.
Oh, I'm sorry. And Derek Thompson behind the chair, I could not see. And for the Board of Commissioners, no doubt we have our very own Commissioner Tyson. Also glad to see that we have some firemen here today. And we also have the chief of the Fayetteville City Police Department is joining us today. And we do have, again, as I stated, our Mayor Pro Tem of the City of Fayetteville. She will be joining us shortly, as well as Dr. Jane Field will be representing our new superintendent, Mr. Bracy. If I missed anyone, please forgive me. Oh, no doubt we also have our town managers here from the city, Doug Hewitt, as well as our town manager, Mr. Greer. And again, if there's anyone else that I have missed, then please do forgive me. I'm looking around the room. It's just great to see so many people here today. And okay. We will continue on, and at this time, we will have our Pledge of Allegiance, and we will also have a prayer. And I would ask that this City Council Member Courtney Banks, if you could please lead us in that today. The prayer first.
Oh, I'm sorry.
That's okay.
Okay. Lord, thank you for gathering us here this afternoon, allowing the city and the county to come together in the hopes that we can collaborate and move our city and county strong. Lord, thank you for those who are making their way and those who are listening in. Allow us to just work together and just keep the city and county strengthened and protected. And thank you for those who we have serving here with our police department, fire department. And I ask that you just keep us in your prayers and keep our community uplifted. In Jesus' name, amen.
Amen. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. At this time, we will continue on with our official agenda. And if I could please ask for the approval of the agenda at this time.
So moved. Second.
Thank you. It has now been properly moved in second. And now, are there any changes, Manager Greer, to our agenda that you can see?
No changes, Chairwoman Jones.
Thank you. And at this time, we will have, today's meeting is going to be about our joint 911 project. So I will call on our county manager to introduce this item.
Approve the agenda.
Can you approve the agenda? I'm sorry.
Madam Chair, we just need a vote to approve the agenda.
Can I get a vote to approve the agenda?
All in favor? All in favor?
Just vote on it.
Thank you. At this time, we will continue with our agenda. This is going to be today, the Joint 911 Project Update. County Manager Greer, if you could please just introduce the items and the presenter.
Yes, over the past few months, there have been discussions about 911 and having a joint 911 center in the county. Chief Freddie Johnson, head of the Fire Chiefs Association, has a presentation that he will present, and afterwards we'll answer any questions that you may have. Freddie, I'll turn it over to you.
Ready, ma'am, if you are.
Yes, we're ready. Please provide with your presentation.
Good afternoon. Thank you for the opportunity to brief the committee's work and also what we've accomplished during the leadership meeting, which I'll explain. But I would be amiss if I did not recognize some of the committee members that are here, starting with Ms. Lisa Reed, the 911 Communications Director for the City of Fayetteville. Deputy Chief Todd Choice, who was a committee member. Fire Chief Kevin Dove. Adam Johnson, and at the end, Gary Crumpler took Gene Booth's place, who's the Emergency Service Director for the county. They're all here present, and they all had input on this. I'm not one to read slides, but this one here is so important.
I'm sorry,
I do wanna
Chief
read
Johnson,
this
can
one
you speak
slide.
up a little bit louder for the
Into the
listening
mic.
audience, for the
Into the
mic,
mic.
and move your mic? Thank you.
All right, let me flip this around. Can everybody hear me back here now?
Yes, sir.
Thank you.
All right. This is an important slide, so I really want to take a moment and just read this slide together that is on the screen behind me. Together, we can build an emergency communication system that not only meets today's needs, but positions our community for a safer, more connected future. The Joint Emergency Communication Center represents our commitment to putting public safety and health first, maximizing taxpayer value, and ensuring that help is always just a phone call away. And I want to caveat that is one phone call away. What brought us here today, and I was a member of all these previous attempts that started back in 2007, and there was a single element that drove it apart, and that was the governance piece. Who's going to be in charge at the end of these studies? And each committee, every time, recommended that there is consolidation. That also created a pattern, because our committee, this committee, unanimously on April the 16th of this year, voted to consolidate. So we put together a public safety working group, and I want to just take a moment here and let you know how we got to where we are. So Chairman Devier and the mayor assembled a public safety working group consisting of all the public safety agency heads across Cumberland County. That's all the municipalities in the county, Sheriff's Office, Cape Fear Valley EMS, Emergency Services, and both PSAPs. And we met. And when we got to our April the 16th meeting, there was a vote. Do we consolidate or we do not? I can tell you that vote was unanimous. We need to consolidate. This is from your public safety agency heads. At the very next meeting, there was a request, all right, let's vote. Who's going to be in charge? And that was the single element that derailed all our past attempts to consolidate. So as chairman, I took the opportunity to elevate this to the leadership group, which is primarily this committee, and both managers were present. We finally met on June the 6th on a Friday, a meeting that started at 4 o'clock. And I can tell you, we walked out of here at 7 o'clock. That was a very productive 3-hour meeting. So some of the recommendations that you're going to hear as I continue this presentation came from the committee as well as that leadership meeting. So it's not all from the committee. I want to just make that clear. So, as I stated, we talked about full consolidation of both PSAPs into a single entity.
Chief, can we advance the slides? You got to advance the
Oh, I
slides.
gotta do that? I'm sorry.
Yeah, or we can, either way. There you go. Do you want to go back and talk any of that?
They didn't tell me that. I thought.
Sorry.
So here's the makeup that I just discussed. And first, on this slide, the recommendation is to use the existing Cumberland County Center at 500 Executive Place, and that is primarily a starting point, as no other facility that is usable at the current form that we have. I can tell you that is a state-of-the-art facility, has lots of room, and it has all the infrastructure that is required of a 911 center. We're recommending an enhanced governance structure for long-term success, which I would call a joint governance structure. And also, we integrated at our leadership meeting, there was a desire to integrate mental health into our public safety answering points, which is very good. So, we want to address a 21st century emergency response, addressing the full spectrum of our community needs. Again, that includes the mental health crisis focus that we have, and that is actually a good thing to do. The governance model allows a collaborative structure and control, a paradigm shift, a comprehensive health-centered approach, and of course using licensed mental health professionals to do that. A cost model is a 50-50 split. That was not the case at our last attempt. Leadership management. We're going to need a consolidated director of our center. And I can tell you, it was my recommendation to the leadership that we select Ms. Lisa Reed, the current City of Fayetteville director. And that is because Ms. Reed has over 30 years of institutional emergency communications knowledge and expertise. She will be the ideal candidate to see a consolidation process from the beginning to the end through. And of course, if she's not available, then we need to step out and hire a professional communications director and do that cooperatively. We also recommended that we do an advisory board, communications advisory board, consisting of all the committee members, public safety agency heads, that is primarily there to do policies and operating guidelines. Infrastructure backup. We do have to have a backup center that mirrors our primary center. And of course, that recommendation will be that next government building we build, a fire station, we add a room and make that a backup center that will mirror our primary center, and do that cooperatively, jointly. This is an important one. There was a lot of concern in our committee meetings. There's no job losses, guaranteed no job losses during the consolidation process. Salary parity, that means we need to get both salary levels from both governments on the same level. And then, of course, program continuity to maintain the current dispatch accreditation and all programs. There was a fear that we're going to lose some of the programs, so we're not. In fact, we're going to have to enhance those as technology improves, and there'll be others. So everything that we currently have will be continued. Technology and operations, I don't think I need to tell you that technology, state-of-the-art, digital dispatch is the way to go. And we also need to have standardized training, and then of course service level improvements and better coordination. If we consolidate, we're talking about no more ring downs, no more second phone calls. It'll be handled in that one center, which makes a lot of good sense for our citizens. The big piece was the integration of the mental health, and I think we have mental health professionals here to address that. And at this time, I'd like to call them up. I don't know who's doing that. The Alliance.
We have Sean Shriver here with Alliance Health to kind of discuss the CIT programs that they currently use and present this information.
Yeah, hi, good afternoon. My name is Sean Schreiber. I'm Chief Operating Officer at Alliance Health. It's a local managed care organization that helps oversee behavioral health services in the region. Thank you to county managers, county County Commissioners for having me here today and for your partnership and support of behavioral health services in the community. What I can share is Alliance is embarked on a similar program in Wake County. So Wake County is looking to implement behavioral health professionals into their 911 call center. The effective launch date of that service will be November 1. And I just wanted to share a little bit of what that looks like. I'm a little bit more familiar with that with Hearts, but the principle is the same. So we will have 3 trained licensed behavioral health clinicians who will be embedded right in the 911 call center. They work closely with the 911 operations team to develop protocols, when to make phone call transfers, how to do live transfers, and also just about kind of joint protocols around escalation, things like that. The goal of these clinicians is to, 1, reduce the time a 911 operator is on the phone with someone who's having a behavioral health crisis. The goal would be primarily to help resolve the crisis, screen for other kinds of behavioral health related dangerousness, such as suicidality, either set up the person with ongoing treatment or take actions that might immediately secure their safety, such as mobilizing a crisis team. This team will work very closely with CIT trained officers to deploy CIT trained officers when needed. And the other thing, what's really important about this service, as a behavioral health clinician is talking to an individual in a crisis, they stay on the phone and continue to deal with that individual until somebody, either a first responder, mobile crisis, family, whoever is recommended, is able to help and assist that member, so the person's kind of never left on their own. And it's also minimizing transfers and things like that back and forth. So the goal is these are clinicians who are well trained in crisis prevention. They're supervised by a psychiatrist, a licensed psychiatrist who will work for Alliance. They do ongoing staffing, training, and backup is always available for call. We will have a tie-in. Alliance runs a behavioral health crisis line. Historically, unfortunately, while we've had this line in all of our communities, when people have an emergency, their first instinct is to call 911. And so we generally do not capture nearly the level of calls that a typical 911 crisis center does. But in the event that those agents are busy taking our calls, there will be protocol to transfer those over. So in theory, there'll always be a behavioral health backup. Again, the main goal of this program is to reduce 911 operator time on a call and to make sure we're deploying the right resource. And there are several resources in Cumberland County that are there today, and additional ones that are being thought and planned through in development. But a goal is to, whenever possible, have a non-law enforcement response to a behavioral health crisis, leaving law enforcement for those more dangerous situations and general safety responsibilities in the community. So with that, I could take some questions that may be most helpful.
We'll do questions at the end.
Oh, sorry.
Yes, I was going to do questions in the end. If you
My
could just
mistake.
finish your presentation, that would be great.
Yeah, so this was the information I was asked to give. Are there updates on any of the other projects that the county is funding that you'd like at this time?
No, it's just this.
Okay, thank you.
Excuse me.
All right, cost model. We're looking at a shared cost model, pretty much operational as well as capital improvements, 50-50. Political equity, predictable expenses, and it's a simplified budgeting for both governments as we move forward. We know exactly what it takes to run this center. And I think that's a very fair approach. Here's a couple examples. Oops, sorry, let me back up. On the governance structures, example of Durham County and City of Joint Emergency Communications Center, Pawtucket County, and there's a regional center as well. And the models are Joint Emergency Communications Board with admin support, single entity control, county or city. While I'm talking about this, you know, as when we met, at one of our early meetings, we brought in the 911 board, North Carolina 911 board, Ms. Pokey Harris, who was the executive director. And there are funds available to help us facilitate this. Merging 1, 2, or 3 primary PSATs into one is one of their highest priority. And so is the funding for that. So the next round is through grants to open up on April the 1st, but the process actually starts in February. So that's right around the corner. We're not so far off, and we really need to take advantage of that. It will really help us on funding as well as for our primary center, and but it make equipment available to move from our primary to our secondary center. I wanted to be short and brief. I'll be more than to take any questions, but the next steps is Chairman Deviere.
Madam Chair, can I?
Yes.
I think what we were, the next steps that the mayor and I had spoke about was really, this was information to bring back to this board based on the joint working group that we collectively put together, move it to the individual boards at next work session or whatever work session the body determines, if October works, and then look to have a joint meeting of the city and the county if the individual boards have a decision point, and then whatever concepts approved, move it through an integrator that the city and county would hire along with a joint committee for oversight during the integration and planning. So in other words, the boards would still need to get in the weeds on the governance model, determine that governance model. As you can see, it said the electeds decide the governance model. The chief showed a couple examples of that in communities in North Carolina that do that. And then also determine the administrative support. I think the boards can have those conversations, and then we can come back together. My recommendation, we come back together and make a joint decision. And I defer to Mayor as kind of co-chairing this.
Same. Chief, first, thank you. And the dedication from all of you all who met, particularly get folks in Friday on a 4 o'clock on a Friday. That's impressive of itself. But I agree with the chairman that there are members of City Council that haven't seen this, and we haven't had that level of discussion. But this liaison did put in place the process, or put in motion the process for you all to meet. But again, I have to take this back so that the council can have a more robust discussion about what the next steps are. And we may, if your schedule allows, invite you to present this and entertain any questions that may be there, as well as from our chiefs as well. But thank you for your hard work, and to all the team that did that.
If I can, I did submit a full report. It's about 324 pages.
Oh, man.
And thanks to your manager, he provided us all the information from the previous 2016-27 consultant, which a lot of that work was very viable for this. It's in the report, as well as all our minutes. It's in there.
Thank you.
And thank you to our chairman as well as the mayor. But I would like also to add that in these conversations, as they stated, that have to go back to both boards, I have sent out some information. As we know, and I appreciate Behavior Alliance being here today, because we know that the mental health component is a very significant part. Therefore, I have sent some information by email for the commissioners to review, as well as the city council members will be able to have that information sent to them. As we know, we have a very unique, special community here, very diverse, but there are some different programs out there. We've got great information, but we want to make sure we are sure to look at all options. So the entire board, the commissioners, as well as the city council and the mayor and Mayor Pro Tem, definitely want to make sure that they have the opportunity. There's some additional information, as they stated. Just wanted to let our listening viewers know that the mental health component, that there is some additional information that will be reviewed. Yes, Mr. Chair.
Madam Chair, if the clerk will, if she can email out to the members of this board or members of this committee the full report. I believe you've got it in a PDF. So following this meeting, if you'll send out that, and I believe you've got copies of the executive summary that you can pass out to this body before they leave as well. Thank you, Madam.
Thank you, Mr. Chairman. And Andrea, I've already sent you the information as far as the mental health component for options. I know that myself and the chairman and the mayor, they probably didn't check their email, but make sure that all city council members and the commissioners receive that as well. Question now before you leave, Chief Johnson, before we bring on our next presenter. We're just trying to do this in decency and order. Thank you for your patience. If there's any questions for this committee to ask at this time, City Councilwoman Courtney McLaughlin, if you would like to ask your question.
Yes, first I just want to say thank you for the presentation, everyone that came together to make this happen. It's been a conversation that's, been going on for some time. I'm happy to see that the mental health has been added along with that. Most of the questions that I had, you pretty much answered it. I'm happy to hear that it was a unanimous vote. So moving forward, the next step, I would think, before it comes to a board is to try to figure out who's going to take on that responsibility, since you guys couldn't figure that piece out. And I think, too, we need to keep in mind when it comes to community, they don't care if it's the city overseeing it or the county. They just want to make sure that when they dial 911, someone shows up to their rescue. Well, one question that you didn't mention, I know you mentioned the 50-50 share cost. What about if that's, or maybe you can bring it to the next meeting, as far as new equipment or facility upgrades that we might see in the future? Would that as well be a 50-50 share cost? Or
That would be a capital improvement, and would be business 50-50.
Okay. And same thing as far as and same thing as far as liability and insurance.
Yes, ma'am, it'll be shown there.
Is that when would that conversation take place, as far as, is that going to be the city, county, or?
We're gonna have
we're gonna have
additional
that
meetings.
before it goes to
Yes.
each board?
That's correct. Well, there'll be different additional meetings prior to it going to the board. We'll have another meeting to discuss these type of situations that you're asking now.
Okay, and the reason I ask, because that's the most important, I would think one of the most important things, we have to figure that part out before we do anything else, instead of constantly keep meeting. That's it, thank you, ma'am.
Excuse me, Mr. Chairman.
I'm not saying.
I'm sorry. You
No,
can
go
just
ahead,
give
go
me
ahead.
one moment.
Yep.
The boards will have, my understandings of what we would like, the boards will have their own individual meetings. And then when they have their individual meetings before we have a group meeting, that is my understanding, because there's initial information that will be provided via that way of email. And then I am also very confident that the chairman and myself will provide additional information as we meet with the Alliance, and also the mayor and the mayor pro tem will provide information to you all, the board members. Now, that is my understanding of the process, and if I stand to be corrected, Chairman Devier or Mayor Mitch Colvin, let me know. But that's my understanding, that the leaders of each board, as well as the boards themselves, will be receiving information, and we will have individual board meetings before we come together collectively. Is that correct from you all's understanding, that you all are going to do things that way on your end, Mayor?
Yes, ma'am. I'll bring it to the city council.
Okay.
Just for clarity, because I know it's a lot of so when the board, the city, you're going to come to the city first, and then you guys going to come to the county.
So,
Right? They're going to have, y'all going to have their separate conversation.
So yes, ma'am, it was going to be either, if it needs to be a special meeting, because I know there are a lot of questions that on our side, and then I think the county's going to do the same.
Right.
Is that what you're asking?
Yeah, because me personally, I just would think that a conversation should be had with all the parties involved to figure out what would be the best option, then come back to the board.
Well, I think part of what has stopped us since, what you say, 2007, is this one particular very important piece that the first slide said a lot, that everybody agrees that this is the best path. The how is the difficult part, so I don't want to have us try to hash out the details of it and then take it back without city council or county commission.
Or at least a recommendation. So
well, if
from the
and I certainly see your point, and maybe what can happen is we can receive Chief's presentation today as a framework to take back to the boards, but I don't want to, I'll leave that to the pleasure of the chairs if you want to try to get to something, but I just think that may make it complicated before the both boards have their input. Because this is the first time some of them have seen it, and some city council members haven't seen it, or commissioners. But I'll defer.
Thank you, Mr. Mayor. That's what I was stating, that not all board members are here today. So it was our intentional, my understanding is that today it's just a preliminary of what the expectation is. And no doubt you all have to meet with your overall team, meaning the city, and that way you all can have an opportunity when you have your meeting before meeting with our board, so that all board members on the city side can ask questions, as we appreciate there are some of you here today, but not all, as the same with us. Our intent on the county side, of which we would respectfully ask you to do the same, but I don't want to tell the city how to run their business. But I do know that that is what the county, it is our intent, the chairman and myself, we will be meeting with our board, discussing matters, questions that we have, and we would like for you all to engage to do the same with your board before we, all that to be hashed out in reference to the overall team can meet, discussions of concerns, recommendations from our overall team, as we would ask and request the same from your team, and then we can have a collective board meeting as far as for both boards. That was our intent. Are you all okay with that on the city side of things? Any questions, Mayor Pro Tem?
No, but
Mayor Colvin?
No, I'm clear, ma'am. Thank you.
Any questions, Commissioner Patel? Any questions for Chief Johnson?
So if I may.
Oh, yes, Mayor Pro Tem.
So I apologize. I'm going to go back to Councilmember Banks McLaughlin. The way I'm seeing this is this slideshow. I know that they said they were going to email. Are we going to get this slideshow today, and it's going to go to the full council? Okay. So we'll come back and then we'll have a work session. Is that correct?
Or special meeting, either one.
Okay. City manager, is that correct? Okay. All right. Thank you.
Thank you. And I just, for our listening audience, that is our intent. We've already discussed it on the county side of things. We feel, of course, it's fair. We need to, there's a lot of information, important information to intake, so no doubt we appreciate your presentation, but it's definitely something the commissioners and I think it's fair to say that the other city council members, as well as this here, need to really look at and, dive into and have separate meetings before we collectively meet together. So again, is there any more questions, everyone?
Madam Chairman, if I just say this, on behalf of all our citizens in Cumberland County, I hope that we can move forward in good faith, do this together, because the benefit is theirs now. So we post this on both doors.
Thank you, Chief.
This will work.
Thank you.
And thank you so much. And at this time, we will continue with our agenda that has been established. Prior meetings will take place with more in-depth questions at that time. In lieu of time, we will continue with our agenda, Alliance Health Project Update. At this time, Manager Greer, if you could please introduce the presenter.
Yes, Sean Schreiber with Alliance Health will present a short presentation regarding the efforts of Alliance Health within Cumberland County.
Thank you, and good afternoon again. Sean
Good afternoon
Schreiber,
again.
Chief Operating Officer of Alliance. Sorry, I did not prepare a slideshow, but I just want to talk about two primary projects that we're working on thanks to county support. One of the things the county had identified was a serious issue with individuals leaving the local detention center, the adult jail, and particularly those with behavioral health and substance use issues, that these individuals were often being arrested, released, not getting linked to services or supports, and sure enough, show back up in jail very quickly again. I think that's a national problem. And we've engaged in a process, thank you to the board's generous funding, where Alliance is establishing a team of social workers and a peer support professional, which is someone who has lived mental health experience, has kind of been through the system themselves and gotten to recovery. And they will be basically embedded to the degree possible within the jail, serving any individual that's in Cumberland County Jail that's been identified by the jail health team, or it could be the deputies or sheriff staff who operate the facility, who believe they have a mental health issue. They will come assess those individuals while they're in jail, either face-to-face or through telehealth, and they'll make sure they connect those individuals for additional service and would be expected to work with someone upon their release for at least 90 days So it's a best practice for any kind of program where people are either in a hospital, in a detention, in a jail, in a prison setting, for them to meet someone who's going to be their kind of treatment advocate and navigator while they're in a kind of more of a confined setting, for lack of better words, develop a relationship and help bring them into the community. We do know that this is a population that is hard to engage, and so we have that peer support specialist. So if the individual is not necessarily following up with all the recommended appointments and supports that are put in place, this is a peer who has been through the system themselves, can go out, help track down these individuals. We're looking to get that program started in December. What's been really nice about this, for the last probably 2 months, staff from Alliance, the jail health have been meeting every other week to develop the protocol, identify the target populations, and make sure we have good communications in place. There's been a kind of attempted effort at this in the past that just didn't have adequate staffing to meet the needs of the jail, so we're very excited to have a team that we think is going to be sufficient to meet the need. That's one project. The second project is a integrated behavioral health primary care practice operated by Cape Fear Valley. Cape Fear Valley Health System has the largest behavioral health clinic in Cumberland County. They also serve the largest number of individuals that are served by Alliance Health who have very serious and persistent mental illness. This is a population who has an above average utilization of both behavioral health services and physical health services. This is a population that are often seen in emergency departments, take inpatient beds, and when they're there, they have a hard time getting out. Cape Fear has been a longstanding partner of Alliance, and the goal is for them to take their large behavioral health clinic and embed primary care and social work support staff in that clinic. So the idea is people who have serious illnesses need to just go one place to get most of their care needs. So if an individual shows up at the Cape Fear Valley Emergency Department, they can now get both behavioral health and primary care services delivered through this team. And this will be embedded within the Cape Fear office that they run out of the executive place in Fayetteville. Today that center serves about 1,500 of just Alliance members and probably countless others with behavioral health issues. Their primary care services that are spread across the Cumberland area serve about another 1,500 individuals. The goal is to consolidate all their care under one setting, again, leaving less opportunity for individuals to fall through the cracks and get both behavioral health and physical health care needed. This will be the first fully integrated, this is called a reverse co-located, where you have a behavioral health center and lots of primary care and physical health built into it. It will be the first in the Alliance region and will probably be the largest setting like this in North Carolina once it's all said and done. And again, this is possible due to the support of the county. So that would be an update on our two major projects. Thank you for your time.
Thank you. We might have, just from our committee here, questions and answers, because I do have two questions, if you don't mind. And then there's also another question that's coming up from other members of our committee. My first question is, and thank you for those updates to keep everyone informed in our listening community. Can you elaborate just somewhat when you were stating about that of the jail and the services for that? Will that include yes or no? And if not, what are the services in place for our juvenile detention? For those that are youth, that's number one. And number two, I know that we have several services for our military and our veterans, but I'd like to know, are there any Pacific Special Services, or do you all have any projects that you are working with exclusively for our veterans in collaboration with Fort Bragg? Those would be my two questions at this time.
Yes, so this project is, the project we're working on is specifically for adults, and it would be any adult served at the Cumberland County Jail if they were a veteran, an Alliance member, generally community member. It doesn't kind of matter who kind of has payment responsibility for these members. Anyone who has a behavioral health issue, substance abuse issue, and needs in the community will be served by this team. We today we fund an agency that does assessments for kids in juvenile detention. We fund a crisis service to help children who could avoid going to such a setting, or as stepping out and they need support before they get behavioral health services, called the MOORS program. But we don't have a specific program for kids in the juvenile justice or juvenile detention center as of this day. And for veterans, we're not the primary entity that serves veterans. To be served by Alliance Health, you typically have to have Medicaid. And for us, we serve a small population of people with Medicaid who have been identified as having a significant mental illness. intellectual developmental disability, traumatic brain injury, but we will coordinate if a veteran calls our call center, we make sure we coordinate them and link them with resources, but we don't offer veteran-specific services as of today.
Okay, thank you. And you stated for the youth, I want to go back to that. So there's nothing specifically in place in Cumberland County. You stated Moores. What is this particular? Can you restate that?
Yeah,
Who
sure.
and where are they located at?
Sure, that's a program run by CommuniCare. It's a mobile outreach and engagement service for youth. It's appeared to a mobile crisis team. If a parent, a guardian, someone who interacts with a youth who has a behavioral health issue, this team can get out there. Again, they're not law enforcement, so they can't have the same response, but they'll get out within 45 minutes to a youth's house, meet with the family, and they'll continue to work with that family to de-escalate the crisis and link with resources for up to 90 days until they can be established in care. And every time we say like up till 90 days, that's the average. If people aren't engaged and they still need support, the team to continue to do that. Sometimes people are engaged much quicker, but that's run by CommuniCare.
Thank you. We'll discuss that at a later date as far as our youth. And so any more questions from this particular committee? Mayor Colvin?
Yeah. Thank you, sir. Thank you, sir, for your presentation. I think I met your CEO maybe about a year and a half ago. So question, you guys are a pretty big operation. How many counties do you cover?
We currently county 7 counties.
It's Cumberland.
Cumberland, Harnett, Johnston, Wake, Durham, Orange, Mecklenburg.
So all the big ones.
All the big ones,
Yeah.
that's right.
So question, are the services that you offer the same in all of them? So in other words, is there a different level? Is it basic, standard, or enhanced? Do we get the same services from you at Wake County or Orange County?
Yeah, so in general, the answer would be yes. The bigger areas clearly have things that the smaller rural don't have, and I certainly consider Cumberland one of the larger areas. For Medicaid and certain funds, we have to provide a network of these services, throughout our region, and there's no difference. There are sometimes differences in the size of programs because we've typically, Alliance has funded things with historical state dollars we have with Medicaid, and then the counties will contribute dollars to augment the system, build things out, and sometimes build things out that are unique to a community. For instance, the project that you're just discussing earlier, the 911 project, that's a project that Wake County had asked us to get involved with roughly about a year and a half ago, and they're funding that operation. It's not something the state or Medicaid typically funds us to do, but as far as programs to serve youth, programs to serve adults, programs to serve individuals with substance use disorders, those kind of services are fairly standard scaled to size. In some cases, it may seem counterintuitive, but for crisis services, you have a 16-bed crisis facility that has 12 crisis chairs open 24/7. Durham and Wake, which have higher Medicaid populations, have the same size program. So it's not always equal, but it's close for those services.
Okay. And second question I have, speak again to the youth mobile response, because I knew there were some instances in the past. I had a former employee who had one of her family members was a youth that needed services from time to time, and there was not a lot of resources here. So can you talk to that a bit? How long have you had that here?
So I'd say this is one of the programs, I think in Cumberland County, it's just been under 2 years. And actually Cumberland County was the second in all the state to have this program. And typically the way you'd gauge, someone could call if they knew to call CommuniCare directly, or if they called Alliance Health. If Alliance Health, we operate a behavioral health crisis line. If we got the call, we would look to deploy that team. We're trying to educate schools. I know we've worked with the Department of Social Services to make them aware of that program. I think like all these programs, they certainly don't meet everyone's needs, but it's been a missing component in the state, and it's spread since Cumberland. I think at least 12 other counties across the state have added this to their array, but it's not throughout the state yet.
Thank you. Thank you, Madam Chair.
Okay. And now we have a question from our Mayor Pro Tem, Kathy Jensen.
Thank you, Madam Chairman. So I have a question something you said. You said the 911 in Wake County has brought y'all in for the mental health component, correct?
Yes.
So how long has that been going on?
It launches November 1st. It's been about a year planning process.
Okay, so it's going to be new starting November 1.
Yes.
So how much was you said that they funded? Was it the city that funded it? Was it the county that was funded it? Was it a 50-50? Not that it matters. I'm just trying to wrap my head around all the 911 and how we can make
Gotcha.
this happen.
So the county is fully funding it. The county has historically funded Alliance, just like Cumberland County does.
Correct.
Some dollars, and the county, I guess, agreed that this would, because it is serving Raleigh, the biggest city within the county, I assume they thought it was fit to use some of those county fundings to support. The program, roughly for the cost of the staff, some of the infrastructure and equipment, it's about $550,000 a year for the staff.
Perfect, thank you.
Any more questions from this committee? Yes, Mr. Chairman?
Thank you, and thanks for the information, Sean. Always good to have you here, and with this joint group, it's good to have you here as well. Just a quick question. You talked a lot about Medicaid, and I know a lot of Medicaid reimbursement. Based on, can you just speak very high level, very short, any impacts that we'll potentially see at the state level that's happening with rebates effect, as well as potentially at the federal level?
Yeah, I think those are great questions. I think on the federal level, I think for us, it's just too soon to really tell what's going to happen. We are very concerned about the rate cuts that were announced. If the rate cuts go into effect, we believe that will lead to a drawback of services, both medical services available to our beneficiaries and particularly behavioral health. Probably many of you who know those services, those are low margin services, behavioral health care, and it's going to be very hard for them to have an across the board 3% cut, hospitals to take a 10% cut. We are hoping that there's a pressure campaign going on and we won't have to enact those cuts, but as of today, we still are on target to enact them December 1st, and we are certainly concerned about that.
Thank you.
Thank you.
Any more questions from this committee? This time, we will continue on our agenda.
Thank you.
Thank you so much, sir, for your presentation. We appreciate you, Sean. Other items of business?
No other items of business.
Thank you, Mr. Greer. At this time, I will inform you all that we will have 2 upcoming special meetings. They will be held in the evening, so stay tuned for the listening audience. Our next meeting for next month will be all about child care, information updates of what we have here to offer in regards to child care, that of areas of improvement that are needed, as well as that of areas of advancement that have been taking place. And again, because we understand the importance of child care and how it impacts those that work here in our community, that particular meeting, stay tuned, will be in the evening. Followed by that, the next meeting after that in November will be all about housing. And again, that meeting as well will be taking place in the evening, and it will be outside of the court house, because we want to make sure, understanding the importance of child care and that of unhoused and the issues that surround housing, that we give the opportunity for our working community to attend those evening meetings. So stay tuned for later information. Our community will be informed. At this time, I would ask for a motion to adjourn.
Madam Chair, just a procedural question. Do we need to, it makes it easier on my end, can we take a formal vote that we recommend that we send the 911 presentation to the City Council, just so that he can have it placed on an upcoming agenda?
Oh, most definitely. We can take a motion for that. I thought we had discussed that's what.
I mean, we kind of implied it, but I just want to,
You want to make it formal?
Yeah, because we want to kind of prioritize it either at a work session or a special meeting. I just wanted to know that was a request that came out of the committee.
That's fine. You can make that
Yeah,
motion.
so I move that we forward the presentation presented by Chief Johnson to the City Council for an upcoming meeting in October, if schedule permits, and I'll coordinate that with the City Council and the manager on dates.
You want to include the county on that, since we're making one motion? Can you include that the county did the same? Or
Sure, I'll amend it
Instead of
to
making a separate
include the
motion.
city and county to send it our prospective boards to the managers to get on upcoming agendas.
I'll second.
Thank you. All those in favor, raise your right hand or say aye. Thank you so much.
All right, motion to adjourn?
Second on that, please.
Second.
All those in favor, raise your right hand. This motion is now adjourned. Thank you all so much.